My name is Irene Barton. It's my privilege to serve as the Executive Director of the Cobb Collaborative. And you may wonder, why does a nonprofit partner with the libraries so much? Because we know that the libraries is a place where all of our residents can come and feel welcome. And that means that we all look and face the issues that our residents are dealing with and grappling with. And that includes mental health. We operate under the collective impact approach, which means we cannot do this alone. We work with partners like public health, like our library systems, like the faith community and others to raise awareness, reduce stigma, and promote resiliency in the mental health space. And that's why it made such perfect sense for us to partner and for me to respond to Tom's email and take that phone call to say, yes, we would want to sponsor and co-host this wonderful conversation. It's my privilege now to share a little bit about our distinguished author and interviewer. So Dr. Dhaval Desai is a dedicated father, husband, son, and doctor, and I love the order that you put those in. I'm sure that was intentional and definitely the way that you live your life. In his work as a caregiver and colleague, he has placed a priority on the well-being of both the patient and the healthcare provider. Dr. Desai's commitment to fostering and advocating for humanity in medicine inspired him to write the book that we will hear so much about. And a lot of the issues that you raised are issues that we talk about, and I know public health does as well, around access to health care, attention to health care along racial and ethnic lines, and emphasis on patient care over numbers, compassion. How do we bring that radical compassion to the healthcare field? Dr. Desai actually grew up in Atlanta and from an early age felt a calling to help people. By his own admission, he was an average pre-med student, but obviously, perseverance, you've made it. In 2012, he joined the staff at Emory St. Joseph's Hospital, where he currently serves as the Director of Hospital Medicine. And he continues to teach and mentor not only other physicians, but future physicians in his role at Emory School of Medicine. He has himself battled some adversity with an autoimmune disease that has impacted his skin pigmentation, and that has only made you more sensitive to what other people experience on both sides of the medical field as caregivers and as patients. And it's one of the reasons why he has stressed the practice of empathy and honest communication in healthcare. Dr. Desai is married to another physician and is the father of 2 young children, which if you read the book, you learn a lot about. I loved that part, learning about them. And it has certainly been an interesting journey over the last 4 years with your family and those relationships, and that you are in the perfect sandwich generation, as we call it. As a hospital leader and physician, Dr. Desai continually puts his passion for healing and caring into practice. He firmly believes that the medical community must place a priority on empathy and compassion. And in this conviction, incorporating humanism into medicine is vital to the future success of our nation's healthcare system. And our conversation will start with Mr. Jeff Hullinger, who has been a long time staple on the local Atlanta news scene since 1984, when Mr. Hullinger came to Atlanta as a weeknight television sports anchor. He's been one of Atlanta's best known and most versatile broadcasters, winning a slew of awards that I will direct you to his official biography to go through all of those.
Not very interesting.
Oh, I beg to differ.
It's an occupation where people get awards as long as you have heart and lung function.
But Mr. Hullinger didn't stay with only sports. He has broadened his reach to local politics and, in fact, regional and national politics. And he's been with the Atlanta community through hard times like the shooting in Centennial Olympic Park during the Olympics, as well as great times when the Braves celebrated not one but two World Series over the span of you being here. So he has a very robust social media presence and received the Distinguished Alumnus Award from Colorado State University. And then as a footnote, and I don't know if this is your proudest moment, you also have had 2 hole-in-ones in your golfing, amateur, I guess, golfing career. So, but please join me in welcoming Dr. Desai and Mr. Jeff Hullinger to our conversation this evening.
Well, it's great to have everybody here tonight, given the fact that the inclement weather has made it quite a journey to try to arrive here tonight promptly. I mean, it has been a traffic mess from east to west and north to south tonight, so we're grateful to have you here tonight. Dr. Desai is such a marvel, such a warm, empathetic man. He has helped my son, has mentored him. My son is a junior at Georgia Tech, hoping for a medical career as well, and I just can't tell you on a personal level what a tremendous man this is, and it is a great honor and a privilege to be sitting next to you tonight.
Likewise, thank you for agreeing to do this. Coming out on a rain night, thank you to all of you for being here, and thank you to Ross and the team for videoing this. I hope we have a great conversation. It's a privilege. I grew up watching Jeff. I always idolized him, and now I'm sitting next to him.
Wait a minute, I'm not that old. Yes, I am, sadly.
But really, truly a pleasure. Thank you.
Well, it is great to be here tonight, and you know, I thought about you on Friday when the CDC issued a statement about COVID-19, about how they believe that it should now be engaged in 2024. And as someone not in the medical community, but as someone who found himself covering these kinds of stories day in, day out for such an extended period of time, and how it affected us, and not only in terms of health, but in terms of politics, in terms of almost every element of American life was impacted by this, that it made me somewhat reflective. And I was curious as to what was your take when you saw that the CDC had changed its stance on how people should deal with COVID.
It's timely. It's 4 years since the first surge of the pandemic. That first surge really hit us in March. It was 2 to 3 weeks after my second child was born. And it just made me reflect that on Friday that, wow, we're at that 4-year mark. Where are we? Truth be told, the reality is we have to adapt. We have to react to where we're at. And we are better at treating COVID now. We have mitigation measures. We have vaccinations. The cases we're seeing in the hospital are not as severe, which makes all of us feel better. So it's time to make the next step in this journey that we're going to have to live with for a very long time with COVID.
Reading also that the 10th installment or update of the inoculation is forthcoming, and it also made me think about how it has shaped and formed the political landscape, whether it's locally, regionally, nationally, or internationally. You can take a candidate like Robert Kennedy Jr., who basically has shaped his entire platform around this belief that COVID vaccines are not something that we should be doing. Are you surprised by that, of how these inoculations have been viewed by the population in so many different ways?
I am not surprised because, one, I lived through it, right? We all lived through it. And being on the front line, going into detail of anecdotes in the book about seeing how that political divisiveness carried over into the hospital. And one analogy I always like to use is that, hospitals are micro societies. So anything happening outside the walls of the hospital will infiltrate into the walls of the hospital. And the vaccine and also COVID, especially in that second and third surge where we started to get people with COVID fatigue denying this is real, and the emergence of the vaccine and the division around that, we saw the political divisiveness, we saw the conspiracy theories, we saw all of that, and clearly that's still perpetuating in this day and age. But the reality is COVID is what it is now because of that first vaccine too. So that did a lot of good for us.
When did you first realize that you were going to write a book, that you wanted to chronicle this?
Yeah.
And prior to your soiree into the literary world, you had not been an author.
That's the truth.
Is there something that lit your pilot light?
She's sitting in the audience. Mita is the literary agent, and this was not planned, but she is here, and I'm so grateful she's here. So truth be told, I've always had an interest in the human experience in medicine and really talking about it. And I'd done a few opinion pieces on my views on certain things about the patient experience. And that first part of the journey of COVID, Chris is also here. He's a professor of human health. He had me in guest lecture, interview with his class, do a little YouTube series, and really talk about what the experiences are like. And Asmita, when she became and joined this agency, she actually proactively reached out to me and said, would you consider writing a book about this? And I had complete imposter syndrome saying, I don't think I'm the right person for this. I really don't. She believed in me, she guided me, she mentored me, and kind of let me loose to do my thing. And 2 years later, 2.5 years later, here we are.
Did you have any concerns at all, given the complexity of COVID and the divisiveness in terms of how it's interpreted by the non-medical community and the medical community as well? Were you concerned about how this might have some impact on your career?
Yes and no. I decided when I first wrote this that I'm going to tell the story, we'll do chronological order, but rapidly realizing there's too much and a lot to talk about. So many other themes going on in my life, from fatherhood, leadership, race, going through my own mental health journey, my own burnout journey, and really experiencing that. And I had to make a decision of how vulnerable I wanted to be and how forthcoming I wanted to be. Did I want to leave details kind of gray zone where it leaves the reader interpretation and reading between the lines to try to figure out what happened? Or do I actually want to go and say, this is what happened, this is what I was going through, and this is what I had to do about it at the time and the conflict that I felt with that? And I chose the latter, and I'm grateful that I did. I did worry, truth be told, that is it going to be too vulnerable where people are going to view me differently in the healthcare world and perhaps outside. But I'm glad in hindsight that I did, because I realized through this journey, and we can talk more about that the vulnerability is a strength, and mental health is something that we really have to talk about. And those that are higher level, higher functioning, not the doctors are the best of the best intellectually, but there's a certain skill set we are expected to function at, and a lot of us don't accept that we need help at times, and we need to change that conversation. And that was a big motivating factor for me to share that story.
So as COVID moved along, were you making notes? Did you have a diary?
It's interesting, not making notes per se, but in this day and age with our smartphones, we take pictures all the time. And for whatever reason, during all those surges, I was taking selfies of myself in PPE. I was taking screenshots of certain emails that came through. And it was more just like, I think I want to remember, I was either going to share it with somebody or this is something to remember. I didn't go too deep into thinking about it. But when going back in that time, I will tell you, looking at those pictures, looking at my face, looking at my family's face, my colleagues' faces, it all came back to me very vividly what was going on.
So to assemble this book, in a sense, with pictures, with thoughts, observations, musings, to capture moments, did you then sit down and put it together?
Not at once. It was in kind of seasons, so to speak. So I would do a chapter at a time. I had a good skeleton outline about the book and where I wanted to go, and I would do it in chunks. So it was not one marathon writing session. It was a series of chunks of writing session and some administrative time, nights, weekends, getting up at 5 a.m. before the kids would wake up and having some time in the morning to do that, and balancing it. But it became a passion project. It was kind of an outlet saying, oh, wow, this is where I'm telling a story. This is fun. This is what it's meant to be. Maybe this is a calling for me. So it felt good.
What has the reaction been to the book that has surprised you?
The reaction's been very positive. People have come up to me and said, wow, I had no idea you were going through this. Other people have come up to me and said, I'm struggling too, and I needed to hear this. Can we talk some more one-on-one and figure out what we can do together? And there's others that had said to me, it's hard to believe we went through that all throughout this journey as a society, as a healthcare society, all of us going through that. So I've received overall really good feedback, and I'm excited.
First of many books to come, or is
I
this
hope so. I don't have any other ideas yet, but
hopefully you won't get any.
I don't want another pandemic to go through. Yeah, hopefully won't get any. But seriously, it's been a pleasure, and I'm hoping that the themes of this book will be timely, that can last forever, because the reality is there's a lot. History tends to repeat itself, and there's a lot in there that I think can last for years to come.
I think for a lot of us who are not in the medical profession and sort of view it as this mystical world peering into a goldfish bowl, I think many of us were surprised by the fragility of healthcare, something that we take for granted as always having been there and will be there, particularly in times of need for any of us.
Yeah.
But the fragility of it really showed itself through the course of COVID and at various times somewhat shocking and frightening in equal parts.
Well said. Frightening, and fragility is still there, I would say. And COVID was the tipping point that said to us that we don't have a fragile healthcare system. Our whole healthcare workforce, probably half of it's been uprooted, changed paths, retired, left the profession, and we have a lot of new talent coming in. We, as systems, are continuing to be asked to do more with less, and that is always a challenge. And all of this became exposed. Also, economic, socioeconomic disparities in patient outcomes, patient access, all of these issues really were always there. Nothing was not, everybody knew this was there, but I think they really came to fruition during this pandemic. And I think, I asked my CEO, who's a very savvy healthcare leader, what's next? When's the normal? And she said, I will no longer make any predictions because we can't predict anything at this point.
You talked a little bit a couple of minutes ago about your vulnerability, and I think that is something that I think that we all can relate to, and we always see doctors and people like you that have excelled academically and professionally, and you hold this place in our community that is so special that oftentimes we sort of forget that you are flesh and blood and that you experience many of the same things that we do as far as needing health care. But your perspective has been one of where you began energized by this to begin with, and it sort of evolved into something very different, very unexpected.
It certainly did, and you're right. Vulnerability is very important, and I realized that I needed to be vulnerable to really talk through this and open about it because I realized during it that if I'm going through it, somebody else probably is too, and it's really important to talk about it. In terms of that energy at the beginning, the adrenaline was there. I was coming back from paternity leave. The news outlets started buzzing that this virus is here. We had one case in the hospital. That was a very big deal. And we thought, okay, well, we're going to peak in a few weeks and be done with this, but this is where we're at. And if you remember, the whole country and societies were buzzing about healthcare workers. We were getting all this praise, and that felt great. That was us positive reinforcement. Wow, we're getting the whole city rooting for us. And going to work, we were getting meals delivered by random restaurants, and it was just a very supported feeling that first 2 months, 3 months, where...
And there were jets. You remember there was aircraft flying overhead.
The Blue Angels.
Supporting healthcare.
Yeah, and we could actually watch it from our hospital parking lot. And actually from our backyard, I remember seeing it too. It was beautiful. It was very well done. And I think, that all felt amazing. And I remember I was changing my son's diaper during one evening. He was 6 weeks old, and I was on speakerphone at the time with something from the hospital, and I hung up, and I was still working on my son, and my wife came up to me and just said, "You're just loving this, aren't you?"
Wow.
And I said, "Loving what?" And she said, "All of this excitement, your leadership, being part of this." And I said, no, I'm not. But truth be told, part of me was loving that excitement. It felt, the adrenaline, it was what it was. We were part of this intense drama scene, and things were evolving day by day, and I was at the forefront helping people navigate it, treating these patients, and it just felt the adrenaline. That's all I can say.
When did it begin to change?
Yeah, the summer of 2020, latter part of 2020. So not long after that, there was that second surge, and it was July, August, where I felt like, oh my goodness, this is not going to end anytime soon. We had all been locked down, we had not really socialized with anybody. We were stuck at home. My 4-year-old at the time was doing this little makeshift pod thing we had created at home with somebody who would come with one of her friends and teach her. It was tough. And I realized that, okay, now I'm really starting to get tired. And at first I attributed, well, I have a newborn, we're not sleeping, it's probably that, I just need to keep going through it. But I rapidly realized there was more to it. I share this anecdote in the book, but I think it's very powerful to make a point. My 4-year-old wanted to learn how to ride her bike without training wheels. And that was my job. I was taking it on. Mom had nothing to do with that. That was my thing with my daughter. And I came home from the hospital at 5:30. It was like July or August, 85, 90 degree heat, hot, humid, as we know. And the last thing I wanted to do was interact with anyone, including my family, and take my daughter out and do this. And that's all she wanted to do. And I said, fine, I'll do it, right? And I had faked it, for lack of better words, and said, I'm going to do this. We're going out. And, I was screaming, pedal, pedal, do, my little tactics I was teaching her. And she actually did a few seconds on her own. And I remember going back in and not feeling hardly any joy at that point. And I reflected on that, saying, something is very wrong. Why can I not embrace this situation and really embrace this moment and be happy? And it's unfortunate. I felt like it took away from my daughter at the time. She didn't know it, but I did. And it was a wake-up call.
Impactful on your marriage as well.
Yeah, we had fights. All marriages have disagreements and fights, I'm sure. But, things were tense at times. My wife is a physician. She went back to work after maternity leave. She doesn't treat COVID patients, but she had to adapt her ways. And by evening time, we were all exasperated. There was no patients left. We were giving enough at work. We were coming home trying to take care of 2 little kids and protect ourselves and not get this virus. None of us knew what this could do to any of us. So certainly,
how concerned were you about that?
Very, very. We had a routine. I would disrobe into street clothes in the hospital, come home, disrobe in the garage, run through the house half naked, telling my daughter to close her eyes before I jumped into the shower. Really, it became a routine. It really did. And all of it, I say it openly because all of my colleagues would do that. But yes, we were very scared. One night, I had taken care of 10 COVID patients in the hospital. We do these, it's 24-hour work, so we have to work different shifts. And I'd come home at 1 a.m., and that night, it was the summer of 2020, I admitted 10 patients who all had COVID. And it was just wild to me. It was like, same thing, boom, 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 boom. And I texted my wife saying, I'm coming home, admitted 10 patients, fell asleep in bed. And it was late. The next morning I was going to be at home with the kids during the day because I was getting off a late shift. And my daughter has this tendency at the time to crawl into bed with us and snuggle up, which is lovely. And my wife came running in a panic. Get away from Daddy. Don't get close to him. Do not kiss your kids today. Do not snuggle with them, anything. And I was half asleep, so cranky. It's like, well, you stay home and take care of them then, But it was the truth. I don't blame her for being angry. I don't blame her for being scared. We were all scared. So there were some tougher days, but we got through it just like most other people did. It
really was like a marathon, wasn't it? I think initially, I even think about it from the standpoint of print and broadcast journalism, that we sort of saw this as a quick race. And when it evolved into a marathon, there weren't a lot of places to go as far as...
And that's how it felt, a quick race. At the beginning, we thought we would be done by the summer. And we know that didn't work out. So are we still part of the marathon? I think we are. We're in this recovery phase where healthcare is still trying to redevelop itself and get its groundings and move forward in this new era with digital innovations. But COVID will always be there. And I would hope we are better prepared the next time this happens, not if the next time this happens.
How did it impact your mental health, this sort of grind of what you are seeing professionally and then, of course, dealing with personally? I mean, you've got a perfect storm that really is swirling around you.
It was that summer of 2020. I told my wife one night saying, something's not right. I need to do something about this. I think I'm having some depression, anxiety, mood disorder, whatever you want to call it. Something does not feel right. And I expected her reaction to be, no, you're fine, you're just tired, blah, blah, blah. And it was actually like, you're probably right, something's not right, and you need to talk to your physician. And I did in a matter of days. And this is a physician who sees me around the hospital because we work in the same system. And when he walked in the office, in my clinic room, and he said, all right, how are you doing? And I said, not great, ups and downs. And he said, okay, I hear you. When are we going to do something about it? And I said, really? It's time? He said, it's time. I've seen you around the hospital. I've seen your face. I've seen your eyes. You're tired. Something's wrong. We need to talk deeper about this. And that was the journey that I began on mental health. And it was first a little bit defense mechanism saying, no, I don't need this. It's not okay. And then we started some medications. And as I talk in the book, that was a journey too. I had to make some changes of that throughout, a year later, and start seeing a therapist. And there was issues with anger, frustration, lack of sleep, and lack of joy. And it was real. And I'm really glad that I had at least enough insight personally left at that point to say I need to make some changes. Otherwise, it's going to get too late. And I talk in the book, and I'm talking about this openly, Dr. Lorna Breen. She's a physician, and she was a physician in New York City. In the first surge of the COVID pandemic, she was working in a very busy ER, And she got COVID, had to take time off, and she never really recovered from that. And long story short, she became very depressed where she could not leave her apartment. She was very isolated. She started having, just complete flat affects, kind of catatonic. Her family came and rescued her, saying, "You're coming home with us in Virginia." She was institutionalized, trying to get her mental health, her psychotic episode, whatever was going on, better. And sadly, after her mental health hospitalization, she passed away due to suicide about 10 to 14 days after. And that's tragic. And when I read her story in the New York Times in summer of 2020, and that story I read over and over, as I read each paragraph, I had a visceral reaction, saying this could be any one of us.
Yeah. And you also have the issue of leadership that you have to deal with, too.
Mm-hmm.
I mean, it's one thing if you are experiencing these symptoms and trying to deal with them as a husband, a father, a physician, but in a position of leadership, so many were looking to you for strength, and you can't show anything other than your proverbial game face, as they say in the sporting business.
That's fair, and that's probably what I felt most of it, especially with the 30 physicians who I was helping navigate. There was a lot of trust they put into me, right? And there was a lot of position of middle management for me where I was getting information funneled to me and then funneling it out and kind of being the middle person and trying to make sure everybody knew that I will still back them up and protect this team more than anything, to the point where we had hidden some PPE in our office because we weren't sure we were going to have anything left for us to use. And it is what it is, but we had to do what we had to do to make sure the physicians were going to get taken care of. And I think everybody was doing their own sort of thing. But I really enjoy leadership. The reason I enjoy it is because I really like connecting with the individuals at that point, the physicians, my colleagues. But there were challenges with that. And there were challenges, more lessons learned from me of knowing I can't have that game face on all the time and show the hero face. And leaders can have moments of weakness too. And weakness may not be the right word, but leaders can have moments of fragility when they're saying, this is not great, not sure what's going to happen next, but at least we're still in this together.
I know reading this, I found myself thinking this is almost like one of those Vesuvius moments, before the volcano and after, and how it just changes everything that was and is to come.
It does. It does. It changed me personally. I think it changed me professionally. I had colleagues who decided to leave clinical medicine, work from home, doing work for insurance companies. And did I ever think that? Yeah, there was a few times thinking, gosh, another surge, I can't do this again. Because we got to 5 surges, 6 surges, and it's like, are we really doing this again? And it got tough. But, those moments are, you collaborate, you have confidants at work, you talk through it, and you keep moving forward. And then you have the patients that are very gratified, they're very satisfied, they're very grateful for what the care we're providing, and we forget that sometimes. And that really, getting back to humanism, that's what feels the most gratifying in this career, knowing that you made a difference, knowing that you connected, and knowing that a patient actually trusts you and really relies on you.
You have beautiful children, and they love you so much. I have seen firsthand. How did fatherhood impact that? How were they impacted in terms of what they were seeing in Daddy and what you were able to give to them?
I would like to think that they were minimally impacted. I would like to think. I think there were certain...
Children are resilient.
I think so, especially the younger ones. You would hope there's some resiliency, and I think there is. We were very honest with my daughter, who seemed to have a pretty decent understanding that there's a virus out there, we have to protect ourselves, and this is why it's happening. She had her moments of frustrations and meltdowns. And I think, we had some ups and downs with it, but I would like to think that whatever I was going through, I never really detached from them. And maybe that was more of a security blanket for me also, because I needed them as much as they needed me. And, I would like to think I was physically always there. Was I always mentally in the moment? No. But physically I was always there. And for better or worse, my little one was an infant at the time, and I think he didn't know any better.
The summer of 2020 was very difficult in the United States, not only with COVID, but also with what transpired in Minneapolis with George Floyd and the sort of reckoning on race in the United States. That only added to what was a summer of certainly of more than discontent, but certainly it stands, even now you look back at that summer, about its impact on America, its impact even, as we move forward politically in this year of presidential politics?
Racism was the twin pandemic of 2020. And that's the reality. Racism always existed before that, so let's not discount that. In healthcare especially, as I mentioned, that how I feel hospitals are micro-societies, the murder of George Floyd was pivotal. And I could see in my colleagues who are minorities, I could see in patients who are minorities. When you walk into a hospital room, patients always have the TV on. All the news outlets, as you know, were filled with the story naturally and appropriately. And you could sense the tension. You could sense it. We had the kneeling ceremony, as you know, nationally on that Friday afternoon, right around noon. I think it was, I don't remember what time frame after his murder that was, but there was a national movement to kneel, I think right around 12 o'clock. And one of my colleagues wanted to do that at the hospital. And I said, yes, absolutely, go for it. So I let some of the administrative colleagues know, saying, we are going to do this. This is the plan. So-and-so is organizing it, just letting you know. And there was some, not resistance, but there was fear. There was fear. And this is not something we could fear at the time, saying that, I don't know if it's a good idea to do this. The reason there was fear is they were scared that certain employees would not kneel because they didn't want to at work, or they didn't believe in it, or whatever the reason, and there would be repercussion for them. And I immediately pushed back, saying, if we do not support this, first of all, this is the right thing to do. And if you do not support this, you're going to have far worse repercussions for this. And they did, and it was a beautiful event, naturally and appropriate, and we needed to do that. But getting back to racism, it just completely uncovered what was going on in healthcare. Taking care of patients with lower socioeconomic, lower education backgrounds, and realizing how easy it is for them to get lost through the cracks. And I realized that firsthand, seeing so many Hispanic, Latinx patients come through that second surge. These were patients who were still working in factories, exposing themselves to each other, did not have the best health literacy, coming in when they were day 6 of illness, near ventilator needing, very sick, and they didn't know any better. And they were trying to make ends meet, and really we had to advocate for them. And I realized more and more, yes, I've always realized about being a human first, advocating for our patients and loving our patients, but we really have to advocate for our patients. The system is not set up for success when it comes to that. And when it comes to racial inequities, I talk openly about some anecdotes in there too, about colleagues who are minorities who have faced racial backlash because of their minority status. And that's very disappointing, but that's what's happened. But I do think there is some positive to this, Jeff. I think the reality is we are better than we were before. So as unfortunate and catastrophic as that situation was, it has now brought up a different conversation in healthcare to ensure the diversity, equity, inclusion initiatives are really going forward, and not just as a cloud saying we have a committee and we're going to do these things. We have the zero tolerance policies. We're not allowing patients to call racial expletives to our staff. We're not tolerating that. And I think other industries have adapted that.
You've seen a lot of that, have you?
I have seen I've seen more than I should in this day and age. Walking as at 11 o'clock at night, getting called for an agitated patient, and an African-American nurse sitting outside, for lack of better words, babysitting that patient so they don't climb out and escape the hospital while he is cursing, yelling, using racial expletives to her. That is not okay. That is not okay. How is that still happening in this metro Atlanta city at this time, 3 years ago? And it was. And I talk about it in detail, how we have to set boundaries. And I set boundaries with this patient, whether it made a difference long-term or not. In his beliefs, probably not. But the reality is we have to back our staff up and back our teams up.
You have a unique perspective on race because of your own personal experience.
I do. So I have vitiligo, and that was introduced in my introduction. So what vitiligo is an autoimmune condition where the melanocytes of my body, I should theoretically be brown skinned because I'm Indian, and over time, my body has destroyed those when I lose the pigment. And initially, it was very patchy when we were growing up, and it wasn't a big thing. And in my mid-20s, it really became rapidly progressive, where it was everywhere. And nowadays, I'm at peace with it. I've accepted it. And I'm more comfortable now talking about it than I ever was. Being a teenager in the low 20s, nobody wants to talk about that. But I am now. And the reason, for 2 reasons. Number one, people need to hear the story and people need to realize. And number two, I realize what people see first. People notice skin color first, no matter what we do. You see your face, your skin color. When I walk into a patient's room and they see my name or card, every day, at least once or twice, I get, Desai, that's Indian, but you don't look Indian. And I said, here we go again. And I don't get into it with patients for the most part. I really don't. Because it's a distraction to them, it's a distraction to me, and I just kind of brush it off and move on. But it happens. And I can't imagine what an African American physician feels like walking into a room, and feeling what they feel and some bias or countertransference from the patient. But I do see and now understand more than ever, and especially that summer of 2020 made me realize that people may be expecting me to sound different, look different, perhaps have a different medical knowledge because of the way I look. And that's the reality. And talking about it is the first step in accepting we are all different, and this is what we need to push forward.
Healthcare has always been so mysterious in this country. I think for those of a certain age who haven't had a lot of experience with health problems, I think we begin to know more about it as we age and we lose parents or siblings, and certainly as we age to the point where we need healthcare as well. But it's been something that is not part of mainstream America that I think COVID has opened the door on a little bit, sort of peek behind the curtain. Do you agree with that? And I say that from the standpoint of, before I read your book, I sort of had these feelings that, well, I feel like I know more about healthcare than I did before COVID. And as I read your book, I had a much clearer sense of what was going on that I had no idea was going on. So I'm going a long way with maybe more of a statement than a question, but
no, we can react to that.
This book, I think, helps give people a view or a periscope of how it really is inside those walls.
I think so, and that's one of the goals. And not only, for me, for future healthcare workers like your son, I think when we go into a healthcare career, we imagine and are promised something that may not always be the reality. And we need to face that. And not having that reality can be very disappointing, disgruntling to somebody like a physician who has trained and put so much sacrifice, so many hours, so much schooling and training, and then all of a sudden you're practicing in a state of disarray, chaos, where you're constantly trying to make things work that should be easy, but they aren't. And you're practicing in a system that's very affected by what's going on outside the walls. And I think we need to accept that. I think a healthcare career is still very fulfilling, and those of us in it are imagining to stay in it and want to stay in it. But we also need people to understand what it's like, and we need the community support to ensure we can have a sustainable healthcare system. So it's a very complex issue, but to your point, I am very hopeful that these types of stories, mine and so many others of physicians who are really out there, not only in books, but social media and the media world that are telling these stories, will be powerful for generations to come.
Do you think it has led to more empathy post-pandemic?
In terms of
healthcare?
Yes and no. I would say yes, that most patients, when I interact and tell them and talk about our experiences, they're like, yeah, we know you've been through it. But know that I think there's still a lot to be discovered about what's going on. And for people to understand that doctors, for example, aren't just getting a big fat paycheck and living luxurious life. There is a lot of challenges we face day to day. And we should remember that nurses face it, respiratory therapists, everybody in healthcare is really giving their heart to try to help the patient. But the way the system is designed, there's so many distractions and competing priorities along the way that I think we still need to continue to build empathy towards the healthcare workforce.
Do you think Lorna Breen's suicide death has really opened the eyes of a lot of doctors, a lot of physicians?
It's opening, I will say that. 300 to 400 physicians in the U.S. die from suicide every year.
It's incredible.
And I have to stop there because you have to think, so no one should die by suicide, right? And I'm not putting physicians on a pedestal. But a physician who is trained, has been through psychiatry rotations, who's done this, who knows the risks, how is that happening? And why is that happening? And it's happening locally too. So this is not something that's elsewhere happening only in New York where Dr. Breen practiced in New York City in the inner city. This is happening everywhere. So I think Dr. Breen's foundation, I will say what it's doing. It's helping destigmatize mental health for healthcare workers. So when I get licensed for the state of Georgia and when I get credentialed to practice at my current institution, on my licensure, historically there's questions about, do you have a history of mental health, illness, any impairment? And in the back of my mind, that always worries me and so many others, saying, well, if I seek help, what is going to happen to my professional licensure, my credentialing? Right. And that's a barrier for people to seek help. I have a colleague who's here, and we're really trying to help break that barrier and that conversation. But even then, to this day, we still can feel that resistance sometimes. And we're trying with these conversations to do that. So the way that question should be, not do you have a history of mental health issues in the past, are you currently impaired by any reason? And that's a reasonable question to ask. We cannot have an impaired physician practicing. But whatever's happened in my mental health past or whatever I'm getting treated for, if those issues are stable, I'm safe to practice. And we should all feel safe to seek that help. And that's one of the things that the Lorna Breen Foundation's really advocating on a legislative fashion and being successful with doing.
There's almost a cultural barrier there, though.
100% cultural. Physicians are trained to not be wrong because we don't want to make mistakes on diagnosis. But the reality is, to err is human, right? We are going to make mistakes. And medicine's an art, not a science. So that we have to accept when we make mistakes. And that's been a process for me to accept that too. When I went in, and I still, if I make a mistake, it jolts me, but I'm getting better about coaching myself through it and having that support system. We can't be perfect. And when life's not going right and we're feeling these mental health issues come up, it's a big, as you say, cultural barrier in our profession because we're supposed to have this tough image, leading the team, leading the patients, and then when you're asking for help, it seems like a sign of weakness, and physicians can't be weak.
After COVID, has there been a period, or even during COVID, where you said, maybe I should not have done this career.
Yeah.
Maybe I should have done something else with my life?
Good question. So I'm a huge advocate, first of all, for teachers and educators. And I've learned this, I'm digressing a bit, but there is a major overlap in frontline teachers and frontline healthcare workers and what they have to do dealing with patients, students, and the system around them. And everybody's still at the front line trying to do what's right for the patient, trying to do what's right for the student. I've always said if medicine didn't work out, I would be a teacher. But I think it's the same sort of themes, like everybody still goes through that. No, I don't regret it, Jeff. I do not. And the reason is I have enough patients that I know I've connected with and helped that I have to keep reminding myself, and not me, but all of us in healthcare, whether you're a nurse, whatever you are, that you are making a difference. The problem is that the situations that are the conflicting situations, the stressful situations, the ones that push you, some of the stories I tell about the patient situations, the political divisiveness, those are the ones that stress us out and we tend to fixate on and remember because we don't know how to process it and we forget the good. So it's a fine balance of us balancing that. And easier said than done.
How do you think, and this is somewhat of an ambiguous question, but institutionally, how will COVID change healthcare in the United States?
I think it's already changed. Long term, I feel at least the next 5 to 10 years, I don't see how we're going to get out of this current state we're in. It's going to take a long time to recover and rebuild. What brings me hope is a lot of digital innovation in healthcare that's coming. Healthcare is very behind digitally, and my book has nothing to do with technology and digital innovation, but I think healthcare is going to rapidly have to adapt to the digital innovation to meet where we're at from a technology standpoint. And there can be a lot of pluses when it comes to patient access, patient care, remote care, if we do it the right way. The problem is the system is so complex with so many players in the mix that to get something done is not as easy as it sounds.
And with COVID, we have seen, in the past, companies like Pfizer and Lilly, they were not companies that people really understood or knew, and maybe we still don't. But there's a much bigger focus on big pharmaceutical companies and their profits and their interaction with those of you in healthcare. Yeah. And this sort of complicated dance it seems to be. I know even in our business, I look at the television network news programs, and almost every commercial is glamorizing Dupixent or some sort of
Ozempic.
Yeah, all of these biological drugs that are marvels, but the flip side of them might cause, bleeding, might cause a lack of breath, might cause a lack of heartbeats, all of those kinds of things. That it's
true.
Wait a minute, the side story of these drugs, man. I don't want any part of that.
You don't want any part of it. Right?
But they have been glamorized to the point where they're almost sold the way that Coca-Cola and Pepsi was another generation ago.
That's a good analogy. I think the pharmaceutical industry is very powerful, very wealthy industry. But, for physicians in the past, 20, 30 years ago, even maybe a little sooner than that, we were able to go to all the dinners, the lunches, and get wined and dined, for lack of better words, by these very, very good drug reps who are very good at their job selling the drug and influencing you to prescribe the drug. That concept exists, but to a much lesser degree now. And I think physicians, probably especially the newer physicians coming out, have a lot less influence from that industry and are trained a little better to be more open-minded.
Even though these pharmaceutical companies are making more money than ever before.
Oh, for sure. I mean, are we gonna prescribe some of those drugs? Of course. But the kickback, so to speak, there's regulations we have to follow that avoid those. So I'm hopeful that there's more of us that are not as influenced by that than there are those that are.
When you wrote this book, and as I have seen you on social media, at the various forums, talking about it in conversation with others, I've always been struck by this. Did you believe that more medical professionals would read it than those who are non-medical people? Is this book more for people like us or people like you?
That's a good question. Who did I envision the reader to really be?
Yeah.
I really envisioned the reader first to be more healthcare workers. I did, and a future generation of healthcare workers. A dream of mine would be that nursing students or medical students or undergraduate pre-med students have an opportunity to read this book to kind of expose themselves, for lack of better words, of what's going on inside the walls. But I realized as I got deeper in the weeds of writing, especially getting back to mental health, burnout, fatherhood, that there is so much parallel to, as you said, we're flesh and blood first, and then we're a doctor, right? We're a human being that other people can also relate to. And it's very powerful. I think there's been a few people who have been non-medical who have approached me and said, it's good to know that somebody in your position and profession is also dealing with what I'm dealing with in a completely different world, and I'm not alone.
Do you think the interpretation is different from those in your business and outside of the business?
What do you mean in terms of?
I think in terms of what they take away from this book.
Yeah, I think so. I think there's definitely different interpretation. If you're non-medical and you're reading the book, probably having a little more empathy towards healthcare workers, perhaps understanding what mental health was, what the pandemic did to us. For those in healthcare, I think it's opening up. The goal is to open up a conversation and be very open about when we're struggling, how we're struggling, and how do we support each other to get through it. So that 300 to 400 physicians a year dying by suicide is not there anymore.
Is that more than ever before, or has it always been in the closet?
I think it's always been in the closet, for lack of better words, that statistic. I mean, it's to a point where we have to have, in September, National Physician Suicide Awareness Day.
Wow, that's mind-boggling.
It is. And nurses go through this, other professions go through this too, but I think the physician rate is higher. They take a lot of weight on their shoulders. And every time I hear a physician suicide, it guts me. I just cannot, it rattles me. And I have colleagues in the audience who I know feel the same way.
Coming out of COVID, do you think those of us who live in Atlanta Metro should have more confidence in the health systems that surround us or less?
Good question. So I reflected on this last week that healthcare is huge in Metro Atlanta. We have so many competing healthcare systems from Emory, Northside, Piedmont, Wellstar. There is a lot of healthcare going on in this metro city. Should we have more confidence or less confidence? I would say equal amount of confidence that we had before. I think we have more confidence knowing we're ready for another pandemic if and when it comes, that's for sure. Maybe some less to maybe slightly decreased confidence when it comes to sustainability. I think we're all struggling in that. And I'm not painting an ominous picture. The sustainability I'm talking about is related to staffing, workforce. We are still struggling. We are not at a perfect place on that yet. And I'm not letting out any dirty secrets by saying that. It's national. It's national.
The great concern around here, as I hear it, certainly in newsrooms, have been emergency rooms have been completely slammed in Atlanta Metro.
Still, and I'll be honest, fiscal year in our world starts back where we add more staff, add more physicians in September. And I'm advocating that I'm going to need X amount of more physicians because the ER volume, to your point, has gotten so much higher, and the percent of patients getting admitted, not going home, is higher. So we're seeing sicker people.
Could you see this being developed into a screenplay, perhaps? George Clooney plays you?
I would love that. Do you have any connection? Let's call him. I would love that. I would love that.
So are you thinking about, are you seeding the idea right now of another book? I mean, this has been something that has been successful, and people banter about it. Those who have read this book come away.
I would love the opportunity to write another book, perhaps in the eyes of a patient. I will share an anecdote. I had a patient about 4 months ago, it was the latter part of 2023, a veteran, a Marine. A Sunday I was rounding, meaning I was taking care of patients in the hospital, and I was just covering one day for a colleague. It was one of those situations, and reviewing my list, and I walk in and see him, and he looks very ill. His belly is very distended and swollen, and it just screamed surgical emergency to me. And long story short, this poor man had a very catastrophic arterial thrombus, meaning one of his big arteries near his stomach was blocked by a clot, and his whole gut was dying. And there's no surgical option for him unless they wanted to go in just and see what's going on. And his wife was traveling from Delaware. The patient, his daughter was at the bedside, and I started seeing him around 9 o'clock in the morning, and he passed away at 3 o'clock in the afternoon. He winked at me 2 minutes before he died. He's a Marine. He did not have any tears during that. He said, I'm a soldier, I'm a fighter, I'm prepared to die, I'm not scared. In those 4 hours, he had his daughter bring a notebook. He wrote down instructions for things like a sign out saying, this is what you need to do. It's eerie, it should give you chills.
Wow.
But those anecdotes like that, I think could be a very powerful book because these patients have such powerful stories.
Is this still a satisfying life for you?
It is more satisfying than it was before because I'm accepting what my pitfalls are, what my issues are. I tell my wife this, that I probably should have done something about my mental health journey in my low 20s, and I was fighting it. And perhaps I would have been a better, stronger person now if I had done so.
But those who become physicians, you've always been at the top of your class, you've had pressures the rest of us haven't had.
Yeah.
The anxieties, I would think, would be commonplace and significant more than those of us who majored in accounting or journalism.
I think that, yes, the pressure is there, the competitive nature is there, but there was still different pressure. If I look back on it, it's crystal clear now saying I was not 100% okay, and I pretended to be.
All right, I'm coming up on 1 hour.
Okay,
so.
let's wrap.
Anyone, can we throw it open to a couple of questions? That would be fantastic.
Sure.
Just say your name and fire away.
Can you think of an event where your ethics as a professional and as a leader, and you having to see staff where you had a moment that you had to think, what do I do here?
Yeah. One comes to mind, and it is one that we all had to deal with, was resource allocation. So during that time, anticipating each surge was going to give us a higher volume of patients, which it did until the vaccine came, and then we started doing this. We, in our EMR, our electronic medical record, there was a pop-up that came on every patient we admitted, and it was 2 options to click. One was, I expect the patient's life expectancy to be greater than 5 years. Other ones, I expect the patient's life expectancy to be less than 5 years. The reason for that was the fear of when we have X amount of ventilators only left of the list, which are the patients that are going to likely survive longer that can be reviewed by a certain committee. It sounds awful. That would get that resource. And I struggled with that. Did I sometimes on patients just put, yes, they're going to be alive more than 5 years, even if I probably didn't know because I didn't want to even deal with that other side of the argument? Probably. We did not get to a point where we had to actually utilize that, but that was a point when I questioned, what are we really doing here? What is going on? And it was scary. The other related to that, the system had leased a refrigerated morgue anticipating such high volume of casualties, and that was scary. I mean, and I will say with that, I looked around the room when that was announced, and I was looking for somebody like Jeff sitting next to me, like, can you believe that? Nothing. Everybody was flat. And I said, what is going on? Why aren't we feeling this? This is terrible. Somebody say something. Anyways.
And the other question is, what was your most challenged time or moment?
It was I think there was a few times in a similar situation was witnessing somebody die alone with no family around them, an iPad in front of them with their wife reciting a prayer to them as they pass, and me being the intermediary holding that iPad in complete PPE. And those are moments you don't ever forget. And I'm not the only one who went through that. This is not about me being on a pedestal like I'm the hero of everything. So many of us did that. And there's too many of those stories. Thank you.
Anyone else? Yes.
Not so much related to COVID, but as we look at just the aging of our population, not only in the metro area, but as a nation, even across the globe, people living longer, the entire population growing older, but maybe not necessarily better, just longer.
Right.
What kind of impact is that going to have on the medical?
That's a really good question. So we are keeping patients alive longer due to therapeutics that we have, but to what quality of life also? What are these patients that have this, they're on a drip at home for their heart failure because their heart's not pumping fast, and we have them continuously hooked up to something that's going to help keep their heart pumping, but they're on their 4th admission in 6 weeks coming back to the hospital. What are we really doing? And that's where the idea of palliative care comes on, that we talk about goals of care, what is our long-term prognosis, and that's something I really love doing, but there's a whole specialty that does that. And I think we all need to be open to have those conversations earlier, but that is a very important point, that as the population ages, we are taking care of patients better in many ways, which is good. What are we going to do when the capacity gets to a point where all of these patients start breaking down, for lack of better words, on their, around the same time? And that's why it's really important for all of us to have these goals of care discussion earlier, so when we're not in the stress of the moment and no one's ready to give up, and then we keep doing these things. But ultimately, is the patient suffering at that point? Atul Gawande, who's a very famous author, he's an endocrine surgeon in Boston. I've heard him speak, and it's basically, he said it simply, are we aligning the goals of the patient with what we are doing? And there's constant malalignment of that, and that's what we really should be focusing on. Easier said than done.
Yes.
Hey there, my name's Kevin. So with, you were talking about how we're kind of expecting a rebuilding period coming up in the next 5 to 10 years, and you were talking about like the long-term health effects when you get COVID. So as a personal anecdote, when I got my first COVID, I got first diagnosed with it when I was 18, and right there, like, I specialize in acting, and I already, like, some of my higher registered voices, for example, were unable to be done, and I feel congested more often after being diagnosed with COVID, even since 2021. Do you feel long COVID as a concept is still kind of a thing versus when it was first reported on? Do you see that kind of affecting how people are diagnosed in the coming years, like, in 15 years, or like, yes, this is the results of long COVID versus other health, whatever they went through, and you see long COVID being a, kind of there?
I think long COVID is a thing. Not everybody gets long COVID. Some do. I think we're still learning about all the systems and what happens with each organ system in terms of long COVID. I don't think it's ever fair for somebody to say long COVID isn't real, it's not a real diagnosis. I think it certainly is, but I think I'm definitely still learning about it and seeing patients saying they have long COVID. Tell me more, what happened? It's like, that does sound something that could be there. So to your point, I think we're going to keep seeing more aftermath from actually getting COVID.
As the pandemic went on, the amount of disinformation grew. And to people like me, it was an annoyance for a while until I had a couple of relatives who bought into some of that, didn't get vaccinated, and died within 7 weeks of each other from COVID. And you're on the front line. How did you handle that, and how did you see that?
It was tough. And I talk about this, but we had several times where that misinformation, especially in the summer of 21, when the vaccine was 6 months in, and now we were approaching, it was Omicron then, and then Delta, or Delta then Omicron. It was Delta, then Omicron, and the patients that were coming in were not vaccinated, patients who were demanding ivermectin, which is the horse dewormer, spending 10 minutes mediating with somebody saying why I'm not giving you that here, are getting arguments back, showing their iPad at me saying this is why I need this, and if you're not going to give it, I'm going to leave. And I mean, having those discussions, those are very taxing times. And did I lose patience? You know, not outwardly at the patient, but I think I definitely was obviously a little bit more direct and firm at that point. But leaving those rooms, that was the hardest part about what is going on here? It takes so much energy out of you battling that, you know, that misinformation at that point.
Did you have people getting in your face about that? I mean, where it was really heated?
Yes. Yes. People refusing to mask also, saying I'm not doing it. The ivermectin was a big one, especially that summer of 21, to a point where our system sent out a message saying, please don't prescribe it. We're monitoring who's prescribing it, and we're going to talk if you do. Because sometimes, you know, people feel bullied. Fine, here's the prescription. Go home and take it. Do whatever you want. You know, but no, we would never do that. But those were issues. And we also had, to your point about, I'm sorry about your family, but patients who would come to the hospital wanting help, but they said, well, I don't want remdesivir. That's the antiviral that we have that doesn't cure you from COVID, but helps prevent you from getting critically ill if you get taken at the right time. And 80-year-old, otherwise healthy, active came in, and his family said, no, we don't want him getting that. We've read everything about it. Just do some steroids and, you know, see how he does. He was in the ICU in 3 days and ultimately passed away. And I would argue if he got the remdesivir, he would have had a different outcome. So those are tough.
Well, thank you, everyone.
Thank
Dr.
you.
Desai, thank you for all of
Jeff.
your
It
insight
was a
tonight.
pleasure.
Greatly appreciate it.
The way you led this conversation, none of this was planned. He said, I can do this. And he certainly did. So
I've read the
thank
book.
you. No, I appreciate it.
Thanks.
Thank you. And thank you, everybody, for coming out on a rainy night. And thank you to Cobb County for hosting.